Good news from the state on coronavirus. Only 600 new cases reported overnight. Monday's often low with lagging weekend numbers, but we are on a little trend now of fewer than 1,000 cases a day since this week. And hey, we'll take it, right? And as the situation with COVID continues to improve, one Valley doctor says he is now concerned about cancer deaths.
Yeah, across the country, right in the midst of this pandemic, studies now show that cancer diagnoses are actually down by about 50%. But Brittany Thomason shares with us tonight why that is actually a huge problem.
The Banner doctor tells me the longer this pandemic lasts, the more cancer deaths we're likely to see down the road. Many patients are skipping the doctor's office. At yearly checkups, you can get blood tests and other screenings for cancers in the breast, kidneys, blood, liver, lungs, and prostate.
Around the March-April timeframe, some of the facilities across Banner would notice about in the range of 60 to up to even 80% fewer patients having their mammograms compared to before the pandemic.
Dr. Villert Loving says this means there may be people out there who have cancer and don't know it.
The concern is if people are not being diagnosed with cancers during this pandemic time, they're delaying the diagnosis, and ultimately that will lead to more advanced cancers at a later time that are harder to cure, harder to treat.
Researchers think we may see more people dying from cancer because of that. Dr. Loving says there are preliminary estimates of what that number may be, but only time will tell.
They vary widely from about 10,000 up to a little over 30,000 extra cancer deaths that would not have occurred had the coronavirus pandemic not affected us.
Dr. Loving says you should visit your doctor if you notice any strange changes in your body. Brittany Thomason, Arizona's Family.